Welcome, listeners, to today's episode of Mihiraa Health Insight. I'm your host, and today we have a very special guest, Dr. Mihiraa, a leading expert in neurodegenerative diseases. We're diving deep into Alzheimer's disease, covering everything from its history to current treatments and future research. Dr. Mihiraa, thank you so much for joining us.
Thank you for having me. Alzheimer's is a crucial topic, and I'm excited to delve into it with you.
Let's start with the basics. What exactly is Alzheimer's disease, and why is it so important for us to understand it?
Alzheimer's disease is a progressive neurodegenerative disorder that primarily affects memory, reasoning, and behavior. It's the leading cause of dementia, currently affecting over 55 million people worldwide, a number expected to rise dramatically as our population ages. What makes Alzheimer's particularly devastating is that it not only impacts the individual diagnosed but also their families, caregivers, and the healthcare system as a whole.
So, it's not just about memory loss.
Exactly. It's about a gradual and relentless loss of cognitive function that severely impacts daily living. And, as of now, there's no cure, only treatments to manage symptoms.
Let's take a step back and talk history. How did Alzheimer's disease get its name?
It's named after Dr. Alois Alzheimer, a German psychiatrist and neuropathologist. In 1906, he studied a patient, Auguste de Terre, who had progressive memory loss, confusion, and cognitive decline. When she passed, Dr. Alzheimer examined her brain and discovered abnormal clumps, now known as amyloid plaques, and tangled fibers, what we call neurofibrillary tangles. These findings are still central to diagnosing the disease today.
Fascinating. So, the disease's identification goes back over a century, but we only started recognizing its broader impact more recently, right?
Exactly. In the early 20th century, it was considered rare. It wasn't until the 1970s and 80s that research confirmed that late-onset Alzheimer's was part of the same pathology as earlier cases, revealing its massive prevalence among older adults.
Now let's dive into the science. What exactly happens in the brain of someone with Alzheimer's?
There are two main biological hallmarks, amyloid plaques and tau neurofibrillary tangles. Amyloid plaques form when fragments of a protein, called amyloid beta, accumulate between neurons, interfering with cell-to-cell communication. Tau tangles are abnormal collections of tau protein inside neurons, disrupting their function and ultimately causing cell death.
So, these plaques and tangles essentially choke the brain's normal function.
That's a good analogy. They disrupt communication and nutrient transport in the brain, leading to cell death and brain atrophy. Add inflammation and oxidative stress into the mix, and the situation becomes even more destructive.
What makes someone more likely to develop Alzheimer's? Are there key risk factors we should be aware of?
Yes. Age is the biggest risk factor. After 65, the risk doubles every 5 years. Genetics also play a role, particularly the presence of the ApoE4 gene. Women are more likely to develop Alzheimer's than men, and lifestyle factors like physical inactivity, poor diet, and cardiovascular health issues can increase the risk.
It sounds like a combination of genetics and lifestyle.
Exactly, and that's why prevention strategies are so important.
Can you walk us through the stages of Alzheimer's? How do symptoms progress?
Sure. In the early stage, the symptoms are mild, often mistaken for normal aging, things like memory lapses, difficulty finding words, or subtle disorientation. In the middle stage, symptoms become more pronounced, increased confusion, difficulty recognizing loved ones, and behavioral changes like agitation or depression. In the late stage, the individual loses the ability to communicate or perform basic tasks, eventually becoming bedridden.
It's truly heartbreaking how it progresses.
Yes, and that's why early diagnosis and intervention are key to managing the disease.
Speaking of diagnosis, how is Alzheimer's detected?
Diagnosis typically involves a combination of cognitive tests, medical history, neurological exams, and brain imaging. For example, MRI scans can detect brain atrophy, and PET scans can reveal amyloid plaques and tau tangles. Biomarkers like amyloid beta and tau proteins in cerebrospinal fluid or blood tests are also emerging as diagnostic tools.
So, it's a multi-step process.
Exactly. There's no single test that definitively diagnoses Alzheimer's, so physicians use several methods to piece together the puzzle.
Since there's no cure yet, how is Alzheimer's managed?
Treatment focuses on managing symptoms. Medications like cholinesterase inhibitors and memantine can help improve cognition and memory temporarily. There are also non-drug therapies, such as cognitive exercises, physical activity, and diet interventions. Caregiver support is essential, as caregivers often bear the brunt of day-to-day management.
Caregivers are unsung heroes in this battle.
Absolutely. Providing emotional and practical support for them is vital.
What's the latest in Alzheimer's research? Are we any closer to a breakthrough?
There are some promising avenues. Amyloid and tau-targeted therapies, like aducanumab, have made headlines, though their efficacy is still being debated. Immunotherapy, where the immune system is harnessed to clear out amyloid or tau, is another exciting area. Researchers are also working on early detection through biomarkers, and lifestyle interventions continue to show promise.
So, while there's no cure, there's hope.
Yes, we're making progress. Ongoing research could one day slow or even halt the disease's progression.
Let's talk about the broader impact. How does Alzheimer's affect society at large?
The economic burden is staggering, estimated to reach $1 trillion in the U.S. alone by 2050. This includes medical costs, long-term care, and lost productivity from caregivers. Socially, there's also a stigma surrounding dementia, which can isolate patients and families.
It's a global challenge, isn't it?
Absolutely. As populations age, Alzheimer's will only become a bigger issue unless we find more effective interventions.
Before we wrap up, what can people do to reduce their risk of Alzheimer's?
There's no surefire way to prevent it, but certain lifestyle changes can help lower the risk. Regular physical activity, a healthy diet, cognitive stimulation, social engagement, managing cardiovascular health, and getting quality sleep all contribute to brain health.
It sounds like living a healthy lifestyle benefits both the heart and the brain.
Exactly. It's about overall well-being. What's good for the body is good for the brain.
Dr. Mihiraa, thank you so much for this insightful conversation. Before we sign off, any final thoughts?
Thank you. I'd just like to emphasize that while Alzheimer's is a devastating disease, research and awareness are moving us toward better treatments and preventive strategies. Early intervention and lifestyle modifications can make a significant difference in quality of life.
And with that, we wrap up today's episode. A big thank you to Dr. Mihiraa for joining us, and to all our listeners. Stay informed, stay healthy, and we'll see you next time on Mihiraa Health Insight.